Next question. Do I need a prescription drug plan? My 2 drugs cost less than the cost of a drug plan, and then I'll still need to pay a few dollars for the drug on the plan. Well, there's 2 answers to this question. There's a technical legal answer, and then there's a more practical answer. So I'm going to give you both. I'm going to start by the technical question. No, you do not need a prescription drug plan. A prescription drug plan is not a requirement for the medical side of Medicare. Medicare Part D and a prescription drug plan, the 2 terms are kind of interchangeable, but you actually don't need a prescription drug plan if you really don't want it. So no, there's no compulsion to take one. Now, that being said, if you don't take a prescription drug plan when you're first eligible to take a prescription drug plan, and you don't have any coverage that automatically goes along with it, if you decide to get a prescription drug plan later, or Medicare Part D later, again, I'm using the terms interchangeably, there is a penalty associated with taking a plan later on. Now, the penalty, here's how they word it, and then I'll kind of break it down for you. The penalty is 1% a month of the national premium average for Part D times the number of months that you didn't have it that you were supposed to, charged every month once you get it for the rest of your life. That's a really complex way of phrasing things, so let me break that down for you. This is 2017, and in our area, the national premium average is about $35, $36 right now. So they actually haven't come out with the 2017 numbers yet, so it's about $35 is what my assumption is going to be. That means that 1% of that is about 35 cents. So they're going to charge you, say you just went 1 month. That's actually not possible. Well, for the most part, it's not possible, but let's say that it was. If all that happened was you were charged 1 cent or 1% because you got the prescription plan the next month, you would be charged 35 cents on top of the premium that you would start paying for Medicare Part D. Now again, that actually isn't that big of a deal. 1% of 35 cents isn't a big deal. Now you add that into 1 year. We're going to actually say, for the purposes of easy math here, that 1% is, that 1 year is 10 months. I know it's 12 months. You don't have to say anything, but let's say for the purposes of easy math that it's 10 months. So you wait 10 months to get a plan, and you're getting a 10% charge. That's $3.50. Again, it's not a big deal, but it's on top of the premium. Say you have that average premium. You found a plan that's exactly the average premium, $35. You'd have an additional $3.50 added on to that plan. So instead of paying $35, you're paying $38.50. Wait 2 years, instead of $3.50, we'll assume that premium penalty amount stays exactly the same, again for easy math, and instead of it being $3.50 added on every month for the rest of your life, it's $7 even added in for the rest of your life. So you see how these numbers kind of go up. 1 year, 2 years, it's not that big of a deal. But let's say that you're adding on a premium, or you didn't have any prescription plan whatsoever, and you decided to wait until now, but you've had Medicare since the Medicare Part D prescription plan first started back in 2006. That's 11 years. Now, that is well over 100 months, and there is no cap at 100%. And what that means is that if you wait over 100 months to get a Part D plan and you eventually need it, that premium is going to go beyond that 100%. You are going to be beyond 100% penalty, so beyond $35 a month, assuming this number remains steady, which it's not, it's going to change, but you would be beyond $35, and the cheapest plans you can get in most states are averaging about $15 a month right now. That's the cheapest ones. So you could, if you needed a plan this year, if you could get away with the cheapest plan, if you got a plan that was around $15, you would still have to add in over $35 in penalties to take it on. Now, you could make an argument that, well, you saved all this money to this point, but you don't know if you need a prescription plan for the rest of your life, you are going to catch up with your savings within a few very short years. And if you live beyond these very few years, you are going to have a penalty that is going to exceed what you would have paid had you had a Part D plan earlier on, all these years to this point. So that is a very serious consideration. If you need a Part D plan and you haven't had one to this point, yeah, you can save money by not having a plan, but there is costs associated with it when you do get it. Our advice to a person that doesn't take any drugs, like the question here, your 2 drugs cost less than the cost of a drug plan, and yeah, you still may need to pay something for the drugs. My advice, get the cheapest plan possible available to you in your state that the drugs will allow. And if you don't take any drugs, just get the cheapest drug plan available. In the long run, if you've got another 20 years in you, another 30 years left of time on Medicare, there is going to be enough savings over a long period of time that it's worth it. Remember, these drug plans that can be changed every single year, so it's a good idea to look into that, because drug plan premiums do have a chance of creeping up. And if you're in a plan that's the cheapest possible plan this year, it may not be the cheapest plan for you next year, but you're still not taking any drugs, it's a good idea to keep on top of that to make sure that you remain in the lowest possible plan, lowest price plan available to you in any one year. If you're our client, we're going to work with you each and every year to make sure that you are in the cheapest plan, so that your plan doesn't just kind of creep up on you, and what starts off being a sub $20 plan becomes a sub $40 plan in a couple of years because nobody's paying attention to the premium. So that is kind of something to look at. And as far as you still need to pay a little bit of cost on the drugs, yeah, depends on the drug that you take. Think of it like major medical, though, in this regard. Yeah, there's a cost on the Medicare Part D premium, but there's a cost on a major medical plan premium. You've still got to pay something for drugs, even if it's only $1 or $2 here or there. It depends on the drugs. That one is not kind of a one-size-fits-all question. As far as people on Medicare Advantage is concerned, Medicare Part C, most, but not all, many Medicare Advantage plans do include prescription drug coverage that is considered coverage as good as Medicare. In most cases, you cannot have a Medicare Part D plan along with a Medicare Advantage plan. So the coverage that you get with Medicare Advantage, whether it includes prescription drug coverage or not, that is the coverage that you're going to be stuck with. Some exceptions apply. Make sure you talk to somebody who knows what's going on in your particular situation before you say yeah, you're good, if you've got any concerns about it. So that's basically it. Just the bottom line is, you don't need to have Medicare prescription drug coverage. You can make that decision whether or not you feel it's appropriate to have it and pay the premiums. Our advice is almost always, if there's no coverage that's going to be there, get the cheapest thing possible if you really don't need it. In the long run, Statistically, the majority of people that live in this country will wind up needing prescription drug coverage because the cost of the drugs themselves that you may eventually need will exceed the premiums that you pay at some point in your life, even if they don't right now.